Thanks for taking a few moments to view this video. Joe DiMatteo of the Ask the Pharmacist group. I hope you enjoy the radio broadcast and many of the different videos that we've done from a teaching standpoint. Everything from how to manage your cholesterol, PMS syndrome, attention deficit, acne. We've done a lot of different little teaching videos. Maybe you can tell some of your friends and relatives about them. If they have specific conditions, they can always go to our station, our YouTube channel, and also right here on the site. But why would I do something on breastfeeding? Well, first of all, what are pertinent topics? What are you interested in is what I have to be attuned to. And I see this coming up more and more. Recently, there have been some articles. There were a few years ago, and they seem to be resurfacing again, focusing on the concept that, you know, these infant formulas are really just as good as mother's breast milk. And I read one the other day, and it was somewhat inflammatory to me. I understand that it's a substitute. I understand that the manufacturer is meeting a need for a family that maybe has no choice, or maybe a mother's unable to produce her own breast milk. All of that is understood. That's not my argument here today. But I become quite perturbed when I read an article that says that it's basically, even this is coming out of the scientific community, we think it's just as good. Why? Because in the 50s, there were deficiencies of Bs, and there were many children that were experiencing epilepsy, seizures, neurologic issues because of the deficiency of the Bs. Well, they corrected that. And then into the 70s and 80s, they realized that there wasn't enough taurine, an amino acid that's incredibly important for neurologic functioning, cardiac functioning. They were deficient in taurine, so they added taurine. Come around 2000, there's a lot of discussions about the importance of essential fatty acids, EPA, and especially DHA for brain development, neurologic development, eye, retinal health, and so on. So now we've added these three other ingredients that were missing in these blocks of time, and we're kind of being led to believe, we're going back, I believe, in time, back to 1950 almost, where the information that's coming forth is saying just as good. And that's what women were told 60, 70 years ago. And I beg to differ with that perspective. If you're in a position that you can make a choice, you need to be informed. You need to have some facts that empower you as a mother, as a parent, and what's the best thing for your child, if at all possible. So let's just talk about some of the benefits of breastfeeding. I made some notes. What are some simple things that we know that breastfeeding does that a formula can't? Breastfeeding induces secretory IgA formation, SIGA, that forms in the gastrointestinal tract of an infant, which would play a huge role at protection, number one, and reducing, we call translocation, or things moving through the intestinal tract into their circulatory system because of that secretory IgA formation. It's not aided in any way from a formula. Number two, we have colostrum extracts that are important as progeners or as beginning points for the child's immune system. It's kind of jump-starting the child's immune system. Now, in many of these formulas today, they're starting to add probiotics and saying, well, we can do what mother's breast milk can do. We're adding probiotics. There's somewhat of a benefit, no doubt about it, but a mother's breast milk produces natural good bacteria. We also know the literature proves that children that are breastfed, that receive natural precursor secretory IgA components from mother's breast milk and natural colostrum, are much less susceptible to candida and fungal yeast overgrowth in the intestinal tracts. You cannot acquire that. And this is not some bash to a manufacturer. I just want to set the record straight. I really felt compelled to do this and to put out there what I believe is more adequate information, and be careful about what you're hearing, seeing, and certainly reading. The other area that we find that there's huge benefits with children is atopic disorders. In children, much research showing, and I'm not going to get into quoting the research today, I just want to give you the nuts and bolts, that atopic disorders, eczemas, dermatitises, allergy, food allergies, wheeze, asthma, that whole spectrum of disorders known as atopic disorders are significantly lower in a family, in a child that has been breastfed versus one that has been bottle fed. So atopic disorders greatly reduced. Recent literature even showing that celiac disease is at a lower percentage in breastfed versus bottle fed. I believe that might tie to the role of Candida and fungal and yeast overgrowth that now is actually beginning to spawn a concept that it might be encouraging the development of celiac disease. So there's a link, somehow there's a link, and there's some study pieces I've discussed on the radio linking Candida overgrowth and certainly celiac disease. Gut barrier function is kind of what I mentioned earlier. The integrity of the intestinal wall, the intestinal lumen, what is termed jejunal gap junctions. Literally, we have little tunnel-like spaces that literally where nutrients pass from the inner portion of the stomach into the intestinal circulation, into our circulatory system. These jejunal gap junctions must be intact. We can't have them as caves, so to speak. They have to be narrow, they have to be intact, they have to be healthy components as what? As a protective mechanism. We know that children that are breastfed have less overgrowth of other bad bacteria and are less susceptible to bad bacterial growth besides just the fungal and yeast overgrowth. Recent pieces of information show that children that are breastfed have healthier thymus gland production and larger thymus glands. Thymus glands produce your T cells. Your T cells are precursors to your NK killer cells. So the takeaway message is a healthier thymus gland, a healthier immune system, a more vibrant immune system. We find a couple specific disorders, gastrointestinal disorders, gastrointestinal infections, otitis media, inner ear infections, respiratory infections, type 1 diabetes are all at a lower rate breastfed versus bottle fed. European Journal of Cancer in 1999, I believe, documented a study and put together literature that showed that lymphomas and leukemias were lower in breastfed versus bottle fed. Sudden infant death syndrome, SIDS, seems to be lower. In a mother that breastfeeds, her rates of osteoporosis, even though while she is breastfeeding, her bone density drops. But over the long run, there's lower rates of osteoporosis in a mother that has breastfed a child. Now, did not want to get into the length of time, whether it's 3 months, 6 months, and there are a lot of components to discuss there. And I probably would like to do a more extensive version of this at some point in time, but I felt it imperative because of some of the information that I've seen circulating lately to just get out a real basic teaching to you. Another very important factor, blood insulin levels. This is very important because this kind of leads to insulin resistance. Blood insulin levels in month-old, 4-week-old infants that were breastfed versus bottle-fed were lower. That means there's less workload being put on that pancreas, even as a 2, 3, 4, 5, 6-week-old infant. Low blood insulin levels, that's a good sign. That's what we all should have, not only as a 50-something, but as a 2, a 3, and a 4-week-old child as well. Breastfeeding. I don't know what else to say other than I think physiologically it is so much more compatible, not only because of my belief systems and my belief system about how we're made and we're created and so on. It is the way God intended it, but I'm very much convinced that not only is it the way God intended it, there are some health parameters, and there's even IQ issues, focus, attentive issues, intelligence that all seem to be, most of the literature showing that it seems to run at a higher ebb for breastfed versus bottle-fed children. The last thing I want to cover today, I don't want to go too long, if you're breastfeeding, you need to be aware of a couple of things. The amount of chemicals that you're exposed to, so what you consume will pass through to that child. So you've got to be careful of the amount of pesticides and herbicides. When you can, locally farmed vegetables or organically grown, whenever you possibly can. We've got to be careful about alcohol and caffeine consumption. Always know that it's going to pass through. Be careful of trans fatty acid, bad fat consumption, deep fried foods. You consume a lot of deep fried foods, those bad fats that you consume, you assimilate, you're passing right through to the child. Just some real basic things for you to keep in mind. Things you might want to make sure you supplement with: quality multivitamins like a daily essentials, D3, iron, magnesium, zinc, iodine, and the omega-3s. Just made a quick list. Why? Because not only do you need those components and you're utilizing them, but now you are certainly providing them to your offspring. Very, very important to consider some iron supplementation. We use a product called Anemia Essentials, organically bound. Doesn't create digestive problems and constipation and so on. Zinc, we've done little video presentations on zinc essentials, why that particular portion or type. Quality multivitamin. There's just some things for you to think about. But number one, is it the same breastfeeding, bottle feeding? No. Are there inherent components that we can absolutely not duplicate? Absolutely. We can add in the B6 that we missed, and the B12 and the B1 that they were missing in the 50s, and the taurine in the 70s, and the omegas in the 90s and 2000. Well, you can replace those components, but there are certain components that you absolutely cannot substitute for that comes from natural breast milk. So the point of clarification is, I think a little bit of a schmooze job that we're receiving today. We're going back in time saying, oh, it's just as good, and we can prove it so. Not so fast. There are still some huge differences and components that you will never be able to completely replace. God bless you. Thanks for tuning in. I hope this helps you in your decision-making process. Thanks for tuning in. Hope to see you again soon.